What's going on, everyone? It's Alex here from Aleks Physio. Today we're going to be going over a case study in which I was able to spot an individual who had a tumor in their mid-back. Welcome. For those of you who are new to my channel, my name is Alexander Krivich. I'm a physiotherapist in Vancouver, British Columbia, and today we're going to be going over how a routine screening assessment of an individual who came in with some back discomfort and leg weakness and numbness in their legs ended up actually being a tumor in their mid-back. How do we come up with this conclusion? Stay tuned to hear about this story. Before we get into it, just want to let you know my role as a spine physio is I'm basically a triage, so I help determine who needs to see a spine surgeon, who doesn't. So I do consultations at the spine clinic here in British Columbia to try to help figure this out. So I'm primarily seeing individuals who are coming in with issues with their mid-back, their low back, their neck, or any combination thereof. Usually pain, but sometimes can be pain in their legs, or weakness, or numbness and tingling, or any other unusual findings. So in this case, obviously for confidentiality purposes, we're not going to be using any personal information related to the case in terms of any imaging or names or demographics. We'll be going over this assessment that I did and what I was able to pick up on to ultimately lead to the diagnosis of a tumor in their spine. The reason that I'm sharing this information is that you understand when individuals online tell you to seek medical attention, that is one of the reasons why. Countless people writing in the comment section of my videos about their specific scenario, and while I appreciate them being open and trying to share their story and trying to get information, you need to understand that the information that I'm providing you is just educational advice. It's not medical advice. And the reason that's important is because the individuals that you're trying to interact with, they don't know your story, they don't know your past medical history, they don't know anything about you other than what you tell them. And in order for them to be able to try to come up with some sort of diagnosis or figure out what's going on, they would need to get more information. So I'm going over this case study as a lesson. If you do have any symptoms or concerning findings, please seek medical attention. Not to trust anyone that you hear on social media or that you see on social media and take it as fact, not even me. And that's very important because the information that we're sending is educational advice only. And I don't want you to think it's something, but ended up being actually something more. Now, obviously, the likelihood of this happening is very low, and red flag findings are very low, but regardless, it's important for you to be mindful of it. So let's get into it. We have this patient, let's call him John. He's in his mid-40s, and he's coming to the spine clinic complaining of a little bit of low back discomfort, but mainly the main issue is weakness in his legs, difficulty with walking, and numbness in his legs. A bit of an interesting case right from the get-go in the sense that there's not really a lot of pain, and we know that weakness and numbness in the absence of pain is generally not surgically indicated unless there's anything sinister going on. Hear the story, I'm asking all my questions, and he's getting better. And this is one of the main findings we look at when we are assessing people is, are they getting better? Because if they're getting better, then that's a good sign. So you would expect. However, when I saw how he was moving, immediately a couple of things came up to my attention. So he was walking with a wide base gait, and he was slapping his feet, or a foot slap pattern, and we call this drop foot. And he was walking in an ataxic manner. Ataxic is just not coordinated, so kind of a little bit wobbly, unsteady. Okay, this is interesting. And I knew he wasn't going to do well on the next balance test, which is to just ask him to walk in a straight line. So I was staying very close to him in case he were to stumble or to fall. And he failed that test completely, completely unsteady. Okay. Again, just adding this to my puzzle in terms of the overall pictures from the subjective. So then we started looking at some of his strength. So mainly I'm looking at things called myotomes. So myotomes are basically the muscles are supplied by the nerves in your spine. The nerves in your spine send signals to tell the muscles to turn on. So I'm looking at the muscle strength in his legs, and I'm noticing that he's quite a bit weaker on the left side relative to the right side, primarily in dorsiflexion, so trying to point your ankles up towards you. And this makes sense because when he was walking, he didn't have the strength to be able to lift his ankle and his toes up, and that's why he was slapping his feet every time he was stepping. And this is obviously a falls risk, and it affects your balance. So weakness in his legs, mainly on the left, issues with his gait, and lots of balance issues as well. His range of motion, his low back, rounding his back, arching his back, all that was okay. Didn't reproduce any of the symptoms, the numbness, or not even really any back pain or leg pain or sciatica. Okay, so let's grab the reflex hammer. So check the reflexes in his knees and also in his Achilles, just to kind of see what the response is like. Typically, when someone has good reflexes, when you tap the patellar tendon, which is just below the knee, you straighten your knee. Kind of classic. You hear about that at the doctor's office, or you've seen that, or probably have had it tested in the past. Well, his reflex was very brisk. So instead of just kind of your knee straightening, his was just like a sudden straightening of his knee on both sides. Okay, brisk reflexes. And then when I check the reflexes in his Achilles, the normal response, the Achilles tendon is your toes to point down, or plantar flex, just based on that tapping of the tendon. Well, his went down, but they started oscillating, or there was what we call clonus. So again, another sign of a very overactive neurological response to a very ordinary stimuli. Okay, so again, we're kind of piecing the puzzle right now. Okay, he has some clonus just from checking his reflex. Let's actually check for clonus. Of course, he's going to have the clonus because he had it during the reflex, but basically what I do is I take the ankle, or you can do it with the wrist too, and you just do a quick stretch. So you bring the wrist in extension, or you bring the ankle in dorsiflexion, and you're looking to see if it starts oscillating. And in this case, it oscillated about 5 or 6 times on the right side and over 100 times on the left side. So it just kept pulsing. Again, this is an over-exaggerated response to just a simple stimuli. And then another test I do is I check his Babinski. So the Babinski is basically you take the other side of the reflex hammer and you stroke it on the outside of the foot and across the metatarsals, or across the ball of the foot. And under normal conditions, when you apply that stimuli, your toes curl. That's kind of a protective response. So toes curl, big toe curls, or you might just have an absent or neutral response. Those are both negative tests. If it curls, that's normal, we want that. Or if it's just absent and if it's symmetrical on both sides. Well, in his case, when I stroked the bottom of the foot, his big toe extended, so it went away from where the stimuli was, and his fingers or toes raised, they fanned out. So this is a positive response. So this isn't the response that we would expect in a healthy or someone who doesn't have any pathology. Okay, so the imaging that I have available is a CT scan of his low back, and it doesn't really show anything. It just shows degenerative changes. It doesn't really help me in my clinical decision making. I'm piecing together everything. So weakness, numbness, getting better, interestingly, a little bit of back discomfort, but issues with his walking, lots of unsteadiness, ataxia or ataxic gait, wide-based, so wide-based stance just to help with his balance. Unsteadiness, can't do a tandem walk or walking in a straight line. His feet are slapping when he's walking. Weakness in his legs. He has clonus in both of his feet. He has brisk reflexes in his legs. Positive Babinski or upward going toes. Okay, so I'm thinking he has a myelopathy. Myelopathy is basically spinal cord compression. What's causing the myelopathy? I don't know. Could it be a tumor, cancer, infection? I don't know, but something is compressing on his spinal cord. And now my role is to figure out, okay, is it coming from the neck? Is the spinal cord compression coming from the neck or in the mid-back? And how do I rule this out? I started looking at the reflexes in his upper body. So I started checking the reflexes in his bicep, in his tricep, in his wrist. I do a test called the Hoffman's, where I basically quickly tap the finger, the middle finger, and I'm looking to see if the opposite 2 fingers bend. That would be a positive test. And then a Tromner, where I tap the underside of the finger pad. Again, I'm looking to see if the fingers are flexing. I'm looking if the reflexes are very brisk when I tap on both sides, or when I tap the tricep, if the elbow straightens violently, and when I tap the brachioradialis, so the muscle kind of around your wrist, I'm looking to see if the fingers bend. Again, these are all examples of very brisk reflexes, and all of them were normal in the upper body. I'm like, okay, so it's likely not coming from the neck, the compression. It's probably coming from the mid-back. So I talked to one of the spine doctors and I say, I think we need to get an MRI of his mid-back based on these symptoms that he's experiencing. And I go over the symptoms, and obviously it's something that raises quite a bit of concern. And we get the MRI done relatively quickly, and we find out that he has a 5 centimeter tumor in his mid-back that is causing these symptoms. So, you know, it doesn't happen very often, but it can happen. These kind of symptoms that don't really follow the pattern. You know, it showed me the importance of the neurological examination, which of course, you know, I knew, and I do the same exam on everybody, but regardless, you know, you can't miss these things, right? Because if you miss them, then this can progress. You know, you can have permanent deficits and issues down the road with regards to this. So, you know, I went over it. He was referred to the spine surgeon, and I haven't checked what the status is with regards to him since that time. But regardless, you know, a great learning lesson for me, and now I'm sharing for you and for my colleagues just on the importance of our role, how we can screen these things, how we're qualified and educated by the spine surgeons to be able to look for these things, and kind of what processes to go through moving forward. I'm not allowed to order imaging myself, otherwise I would have ordered an MRI of the mid-back, but you know, I was able to collaborate with a spine doctor that works at the spine clinic as well to kind of spearhead that and to guide the next steps moving forward. So there you have it. I've never gone over a case study before on this channel, but I went over this mainly just to try to, you know, give you, the listeners, if they're still listening to this, some education and some understanding, and to kind of see what's out there and what I can see on a basis intermittently. I mean, most people that I see generally are non-operative, but there are some that obviously require surgery, and some possibly, you know, more expedited than others based on what's going on. Hopefully you found some value, and hopefully this kind of reintegrates or reinforces the fact that, you know, as much as natural as it is to want to seek help for your condition or presentation, it's really important that, you know, you see somebody qualified to be able to go through a thorough assessment with you. The patient had no idea, obviously, and some of these symptoms were just believed to be coming from the low back, and that's kind of what they were told in the past as well. So these are the things that we look for. Again, hopefully you found some value in this video. If you want me to share future case studies like this moving forward, let me know down in the comments. If you thought this was something that was educational, informative, let me know. If you found value in this video, please consider checking out some of my other videos. I have over 500 videos on various physio, exercise, and medical related topics. And if you still find value, please consider subscribing to my channel. It really allows my channel to grow and allows me to reach a wider audience. Until then, we'll see you in the next video. Thanks for watching.